In this part of the lecture, guys, I'll discuss treatment of dependence on alcohol and smoking. For alcohol dependence, we have some drugs which are FDA approved drugs. FDA approved drugs for treatment of alcohol dependence, and these are only three: disulfiram, naltrexone, and acamprosate. Disulfiram, naltrexone, acamprosate, these are the only FDA approved agents. Naltrexone I have already discussed. It is an opioid antagonist. Naltrexone is an opioid antagonist, whereas acamprosate it inhibits glutamate receptors of NMDA subtype. Disulfiram, how it acts, I'll describe at last once I'm through the drugs which are used for treatment. So these are FDA approved treatments. Then we have some drugs which are not approved by FDA. These are non-FDA or drugs which are used off-label. Drugs which are used off-label for treatment of alcohol dependence. So these are benzodiazepines. I discussed in sedative hypnotics like benzodiazepines, diazepam, clorazepate, chlordiazepoxide can be used in alcohol dependence. We can also use clonidine and some recent drugs which are nowadays used in alcohol dependence are drugs like topiramate and even ondansetron. Topiramate, ondansetron. Nalmefene, another opioid antagonist, is currently under trial. So all these drugs which I've discussed here, which are used for treatment of alcohol dependence, except disulfiram, all these drugs which I've discussed here, the logic of using these drugs is that they decrease craving. They decrease craving, or they decrease the desire to consume alcohol. So they decrease craving for alcohol. Whereas disulfiram, it has a different mechanism. How does disulfiram acts? To understand the mechanism of action of disulfiram in alcohol dependence, you have to understand metabolism of alcohol. So alcohol, guys, is nothing but, what is it? Alcohol is nothing but it is ethanol. Ethanol or alcohol, it is metabolized by an enzyme called as alcohol dehydrogenase. Alcohol dehydrogenase into acetaldehyde. And this acetaldehyde is further metabolized into acetic acid by an enzyme called as acetaldehyde dehydrogenase. Acetaldehyde dehydrogenase. Guys, here this drug disulfiram is used in alcohol dependence because what it does is disulfiram inhibits acetaldehyde dehydrogenase and thus will lead to accumulation of this compound called as acetaldehyde. So disulfiram inhibits metabolism of acetaldehyde and leads to accumulation of acetaldehyde, which causes side effects. Accumulation of acetaldehyde can cause hypotension, restlessness, chest discomfort. So these are some of the symptoms that would be seen whenever disulfiram is consumed along with alcohol. So you will tell the patient that if you take alcohol along with disulfiram, you will have these symptoms, and because of the fear of this, if you will take once, he will fear these side effects, and being on disulfiram, he will not take this drug. He will not take alcohol along with this drug disulfiram. So in other words, he will develop aversion to alcohol, or in other words, I can say the mechanism of action of disulfiram in alcohol dependence, it is used as an aversive agent. It is used as an aversive agent, but remember, you cannot prescribe left and right to every patient, because you never know when the desire overcomes the fear and he consumes alcohol in presence of disulfiram, and he might die because of that as well, isn't it? That is why you prescribe disulfiram only to those patients who have a proper caretaker, and you must make sure that the caretaker is also non-alcoholic. Alright. So guys, these are drugs used for alcohol dependence. Now let's have a look at the second half here, smoking dependence. Smoking dependence. For smoking dependence, number one, we can use, guys, what we can use is nicotine replacement. So nicotine for nicotine. Nicotine for nicotine, nicotine replacement. And nicotine replacement can be used in the form of skin patch on the skin patch, gradually it will be absorbed. It can be used in the form of gums, chewing gums. It can be used in the form of patch, gums. It can be used in the form of lozenges that dissolve in the mouth. And it can also be used in the form of inhalational, in the form of spray. Out of all these forms of nicotine replacement, the most effective form that is seen in clinical trials for de-addiction is this inhalational form of nicotine. So one is nicotine replacement can be given. Second, we can use an antidepressant. So guys, bupropion is an antidepressant. Now I'm discussing here, I did not discuss it in antidepressant because it is primarily used as an anti-smoking agent. Bupropion, it is an antidepressant which acts by inhibiting dopamine transporter. DAT is dopamine transporter that is required for dopamine reuptake into the presynaptic neuron. So by inhibiting that, what it does, it increases dopamine in the brain. It increases. So bupropion increases dopamine in the brain. It increases dopamine in the brain, and this dopamine gives us an effect that is similar to the effect caused by nicotine. And bupropion side effect, it causes nausea, vomiting, that is understandable. Why? Because bupropion will act upon D2 receptors in the CTZ area that will give us nausea, vomiting. A third drug, if you remember, I discussed in autonomic nervous system, and this drug is called as varenicline. A third drug, this drug is called as varenicline. Guys, what is varenicline? Varenicline is a nicotinic receptor agonist. It is a nicotinic receptor agonist The problem with varenicline is that it is associated with side effects like mood disorders. Mood disorder, as well as it can also increase suicidal tendency. Now that is a turn off, isn't it? Suicidal tendency, because smoking is much better than death, isn't it? So if you smoke, you will die some years later. So that's on a lighter note, guys. I'm not advocating smoking, it's not a good habit. But suicidal tendency is a turn off for this drug, and that is where you have to be careful. You have to monitor the patient while you give this drug called as varenicline. Apart from varenicline, some miscellaneous drugs which are used in smoking dependence, I have already told you, nortriptyline, and clonidine can also be used in smoking dependence. So as these are the drugs used in smoking dependence, nicotine can be used, bupropion, varenicline, we can use antidepressant, nortriptyline and clonidine. And with this we come to an end, not only to the topic of dependence but also to a huge topic of central nervous system.